Hi everyone, Natalie here, and today I'm going to talk about the difference between sciatica and piriformis syndrome. So we got to start with a little bit of anatomy so we can understand how the body works. But when we talk about sciatica and piriformis syndrome, it's typically pain, tingling, numbness, or any kind of irritation that may be going down the leg. It can start in the glute, it can start in the low back, and it runs downward. And it could be on both sides and it could be one side. So to kind of define the differences, true sciatica actually comes from the low back. So if you have true sciatica, it's going to be something a little more clinical. So you may have a herniated disc that's putting pressure on the nerves in the low back, and those nerves run down into the legs, and that's where you're getting some of that pain from. You could have degenerative discs. So this, the discs space between your vertebrae is degenerating, and that can put pressure on the nerves. You may have spondylolisthesis, and that's just a slip of the spine. So when you look at the vertebrae and they sit on top of each other, one has slipped forward, and that can compress on the nerves. The other thing that it could be is spinal stenosis. So when you look at how our vertebrae sit on top of each other, there's very small little holes and spaces where all of the nerves run through. And spinal stenosis is when your body starts to create more calcium and more bone buildup, and it starts to narrow those spaces, and that can also put compression on the nerves. So if you actually have true sciatica, it's going to be coming somewhere from the low back. It's going to be one of those four, degenerative or medical issues. And that's something that you typically want to see a doctor for. You need to get some kind of imaging, X-ray, MRI, and it's going to be something that's a little harder to treat, but it is also still treatable. With spinal stenosis, if you really build your core strength, then you can actually help to support those muscles, and your body may actually reabsorb some of the calcium and open up those spaces. With a herniated disc, if you build core strength and support those discs, you can actually have the disc start to slip back forward, and because you're creating a good amount of stability with your own body strength, it will relieve some of that pressure on the disc as well. Spondylolisthesis and spinal stenosis and the degenerative disc, those are a little harder to treat, but they take time, and you want to work with a doctor and a professional for those. So for the everyday person that thinks that they have sciatica, there's probably a more likely case that you have piriformis syndrome. So when we look at the nerves that actually run down into the leg, they actually run through a very small space right in the center of your glute. And the muscles that cover those nerves can actually start to compress, and that can cause you some pain. So let's get some close-up looks at how the body works a little bit. So this is just half of a pelvis, and you can see the bone, you can see the ligaments, and there's this small space right here, and that's where your nerves actually run through, all of your sciatic nerves. So you can see that it's a small space, and if the glutes start to get tight, they can actually compress on that. So here's another picture. This one shows the sciatic nerve coming out. So the yellow is actually the sciatic nerve. You can see it on this side without all of the ligaments. And then we've got this little triangular muscle. That is called your piriformis. So when you have piriformis syndrome, it's when that particular muscle, as you can see, sits right on top of it. If that muscle gets tight, it's going to shorten, and it's going to press on the nerves. So here's just a picture of the nerves that run down your leg, all of your sciatic nerves. So they go all the way down to your foot. And if you're getting true sciatica, so again, it's coming from the low back, it's either degenerative disc, herniated disc, spinal stenosis, or spondylolisthesis, you'll actually get pain or numbness, tingling, weakness of the legs, but it's going to be more in what's called our dermatome patterns. So this shows the front of the leg, and you can kind of see how there's different colors. There's the orange and the pink. I hope you can see that okay. And these dermatome patterns, you can actually figure out depending on where you're getting your symptoms. If it runs kind of in this pattern, wrapping around the leg, that means it's actually coming from the low back, and it's more of a true sciatica. If it's coming down the back of the leg, you're more likely having piriformis syndrome. It's coming from the glute itself. It's that tightening. So that's a little bit about how to tell the difference. Some symptoms that you might have, it could be constant pain. You're going to have more symptoms while you're sitting than when you're standing, because as you're sitting, you're compressing on those nerves. Or if you're sitting and you're dumping into your low back, you might be putting more pressure on the nerves in the low back. So that could be part of the reason. You may have some burning, kind of searing sensations, sharpness, tingling. Those are all nerve type of pains that you may feel. And those could be either sciatic or they could be piriformis syndrome. And then some of that weakness, numbness, inability to engage the muscles, that's going to be more of the sciatic pain. And that you actually want to make sure you really take care of sooner rather than later, and go see a doctor, go get it checked out, because if you're dealing with some of that inability, that numbness to activate those leg muscles, you can do permanent damage if you wait too long. So please don't wait on that. But either way, you want to do a few different things. So if you go to the doctor, you find out you have some of the sciatic stuff, ice is going to help you, and it's going to be primarily on the low back. But some things you can try out first. If you think you may have piriformis syndrome, there's a couple things that you can do at home to help relieve it yourself. We want to do some tissue work, so you can get on a foam roller and release your glute. You can also stretch, doing the figure 4 stretch, and some other things is you can go get an adjustment or have some mobility work done, either by a physical therapist, a chiropractor, or a certified athletic trainer like myself. And typically, after you've done a lot of this tissue work on it, the nerve is already flared up. That's why it's causing you problems. So ice is going to be your best friend. Do not put heat on nerves that are irritated. It will increase the blood flow into that area, and it will cause more inflammation. So ice is going to be your best friend. And if it is piriformis syndrome and it's coming from the glute, you're actually going to ice right on that glute. If you've got some of the low back stuff going on, you're going to ice right on that low back, okay? So I'm going to show you just 2 quick things that you can do. Like I mentioned, the foam rolling and the stretching, so you can have an example of how you can start to heal some of this on your own. All right, so I've got my foam roller here, and what you're going to want to do for your piriformis syndrome is you're going to want to sit on the foam roller. So I'm going to assume that I've got some sensations and tight glutes on my left leg here, the one facing you. And so to put this muscle on stretch, I'm going to bring my hands back behind me. I'm going to bring that left foot up and put the ankle over the knee, and then I'm going to actually rotate towards that side. So I'm going to roll up and down on my glutes, and you want to play around a little bit with your motion here. Different angles you're going to feel something different. So, go a little bit to the outside, rolling up and down, roll up and down right through center, maybe come a little more, inward. When you find a spot that's really tight, maybe just hang out, sit right there. You can roll a little bit up and down, kind of dig into it a little bit. You want to release those tight areas in your glutes that might be putting pressure on your sciatic nerve. If the figure 4 stretch on this is a little too complicated for you, you can have both feet down. That's fine. Just lean to one side, and you can start to roll up and down on that glute. Do this on both sides. If you notice one side is particularly tighter than the other side, and that's the tight side is where you're having the problems, then most likely you've got the piriformis syndrome going on. And if you continue by releasing that, that can really help. Now, if there's a significant difference as well, most likely your pelvis has shifted. Something is off, and that's where it would be also very helpful to, like I said before, work with a PT, an athletic trainer, maybe get an adjustment by a chiropractor, just to shift the pelvis back into place so that it's not tugging and pulling. But if you don't have access to that, or you just can't afford that, that's fine too. Start at least with the foam roller. And then the other recommendation I have is doing what's called the figure 4 stretch. It's going to put that piriformis muscle on a stretch so that you start to release it. So you're going to lay down on your back. You're going to cross one ankle over the other knee. We call it figure 4 because you can look, it almost looks like a 4 from my perspective. You'll bend your knee in. You can bring your hands through, either wrap under the thigh or over the shin. You never want to grab right on the knee. That's a joint. And just pull that in towards your body. With this stretch, I like to lean to one side and then the other. You can kind of find where you get the most stretch. Typically, if you lean towards the side where your leg is in a little more neutral position, you'll feel more of a stretch. Just hold that stretch, maybe 20, 30 seconds, release off of it, and do that a few times. So if you've got Piriformis Syndrome, or even if you think you have sciatica, this is a really good place to start. Start by doing some foam rolling, go into your stretches. If it's still irritating you or that flares it up, make sure you ice down the glutes. And then if you have access to a PT, athletic trainer, or chiropractor, go get it checked out. Just make sure your pelvis is in a good alignment. They can help adjust you. And to prevent the pelvis from shifting, you're going to want to do some exercises for your outer hips as well. Those are your glute means, and those are going to stabilize your hips. So I can go into that a little bit more next time, but for now, hopefully this helped give you a little insight to maybe some symptoms and experiences you're having. And hopefully this will help you learn a little bit more about your body, or maybe you know someone who's going through this right now. So please share this video. Feel free to comment and contact me. I'd love to answer any questions you have, and I hope you have a wonderful, beautiful day. Thanks for watching.